Good day everyone! We are Group 1 and here are the members of our group. Me, Alida Marimar, Carlos Vanessa Jem, Mungaya Mary Benice, Mendoza Melissa, Chavez Amiel, Petines Daniela, and De La Rosa Benjobi. Before we start, the topic that came to us to discuss was intellectual disability. What is this? Intellectual disability or ID is a term used when a person has certain limitation in cognitive functioning skills, including communication, social, and self-care skills. This limitation can cause a child to develop and learn more slowly or differently than a typically developing child. Intellectual disabilities can be due to health problems, genetic conditions, environmental factors, and problems during pregnancy and birth. The common types of intellectual disabilities include autism and Down syndrome.
And these are the characteristics of students with intellectual disabilities. First is mild to significant weaknesses in general learning ability. Second is low achievement in all academic areas. The third is deficits in memory and motivation. Fourth is inattentive or distractible. Fifth is poor social skills. And sixth is deficits in adaptive behavior. And these are the syndromes associated with intellectual disabilities include first Down syndrome, Fragile X syndrome, fetal alcohol syndrome, Prader-Willi syndrome, Angelman syndrome.
Nature and characteristic of intellectual disability. First, the term intellectual disability refers to the level of cognitive functions that is demonstrated by particular children. It is the circumstance in which a children's cognitive functioning is impeded to the point causing of significant disability in receiving information from his or her environment, then effectively processing, problem solving, and adapting to this information. This paper provides an overview of children with intellectual disability, incorporating definition, causes, and classification for conceptual understanding. Intellectual disability is characterized by significant limitation in intellectual functioning and adaptive behavior, the latter expressed as concept, social, and practical adaptive skills. An intellectual disability is defined as an IQ below 70 and deficit in adaptive behavior and daily living skills, eating, dressing, communication, participate in group activity. People with intellectual disability learn slowly and have difficulty with abstract concepts. This paper also throws some light on the characteristics of people with intellectual disability. Characteristic of intellectual disability. First, the common characteristic of intellectual disability is difficulty in learning and processing information, problem with abstract thought, and problem with the social interaction occur at a varying levels unique to each individual. Learns about the differences between mild, moderate, and severe intellectual disability. Intellectual impairment involves problems with mental abilities that affect day-to-day functioning in three areas. First area, conceptual, includes problems with skills, language, reading, writing, mathematics, reasoning, memory, knowledge, retentions. Another or second one is social, refers to issue with empathy, judgment, communication, making, and keeping friends and other social function. And lastly is practical. Focus on problems with self-care such as personal hygiene, job duties, personal finance, organization. It's critical that parents who suspect their child may have an intellectual impairment seek counseling and help from qualified mental health and medical professionals.
Now, let's discuss the different types of intellectual disability. Let's discuss first the autism. Autism is an intellectual disability affecting the nervous system and the structure and function of the brain. The disability affects the way an individual communicates, acts, learns, and interacts with other people. An individual with autism has social skills challenges including interacting with other people, communication, repetitive behaviors, and restricted interests. Next is Down syndrome. Down syndrome is an intellectual disability stemming from having a part of or an extra copy of chromosomes 21 in the DNA. It is the most common chromosomal cause of mild to moderate intellectual disabilities in children. Down syndrome's common symptoms include slow learning, short attention span, impulsive behavior, poor judgment, and delayed language and speech development. Children with Down syndrome have poor muscle tone, making them take longer to learn how to make some movements such as turning over, walking, standing, and sitting. Some of the physical characteristics of individuals with Down syndromes include flattened facial profile and nose, upward slanting eyes, and small head, ears, and mouth. The third one is Fragile X syndrome. Fragile X syndrome is the most prevalent form of inherited developmental and intellectual disability. This genetic disorder results from a change or mutation in the X chromosomes. The disability affects the development of a person, more also in the areas of learning and behavior. What's more, it can affect physical appearance, communication, skills, and sensitivity to the individual's light and noise with intellectual disability. The fourth is fetal alcohol syndrome. Fetal alcohol syndrome is an intellectual disability caused by exposure to alcohol during pregnancy. Women who drink alcohol during pregnancy expose their children the risk of this disability. And last is the Prader-Willi syndrome or PWS. Prader-Willi syndrome is a genetic disorder occurring due to a problem with the part of chromosome 15. Babies born with the disabilities are poor feeders at infancy. Still, the feeding habit changes at the age of 2, where the kids' hunger becomes insatiable, making them unable to control their appetite. The vicarious hunger leads to problems such as diabetes and obesity.
What are the most common causes of intellectual disability? The most common causes of intellectual disabilities are genetic condition. Sometimes an intellectual disability is caused by abnormal genes inherited from parents, errors when genes combine, or other reasons. Example of genetic condition are Down syndrome, Fragile X syndrome, and phenylketonuria or PKU. Second is complication during pregnancy. An intellectual disability can result when the baby does not develop inside the mother properly. For example, there may be a problem with the way the baby's cells divide. A woman who drinks alcohol or gets an infection like rubella during pregnancy may also have a intellectual disability. Next is problems during birth. If there are complications during labor and birth, such as a baby not getting enough oxygen, he or she may have an intellectual disability. Next is diseases or toxic exposure. Diseases like whooping cough, the measles, or meningitis can cause intellectual disabilities. They can also be caused by extreme malnutrition, not getting appropriate medical care, or by being exposed to poisons like lead or mercury. We know that intellectual disability is not contagious. You can catch an intellectual disability from anyone else. We also know it's not a type of mental illness like depression. There are no cures for intellectual disability. However, children with intellectual disability can learn to do many things. They may just need take more time or learn differently than other children.
Treatment of intellectual disability. Special schools and individualized therapy programs can maximize the potential of an individual with intellectual disability. Treatment of the person diagnosed with intellectual disability mainly involves teaching adaptive, self-help, and social skills and other rehabilitative measures. The treatment plan and outcome depend on the severity of retardation. Mild cases can be enrolled into special schools where basic reading, writing, and other academic subjects and occupational skills can be taught. Budgeting, money management, and simple calculations are included in the curriculum. Classes for the moderately and severely affected mostly aim at training in self-help and safety issues. Training on simple jobs and repetitive jobs can be given. The profoundly affected need hospitalization or constant care, along with care and supervision in the daily routine. Many special institutions and special schools are available for the intellectually disabled, which can offer speech therapy, occupational therapy, physical therapy, training with special assistive devices, family counseling, and even nutrition services. Rehabilitation services for the intellectually disabled can be obtained through special education clinical programs, social services, and vocational rehabilitation.
Strategies in the classroom. It is important to know that despite difficulties in a learning environment, students with intellectual disabilities can and do have the capacity to acquire and use new information. There is a range of inclusive teaching strategies that can assist all students to learn, but there are some specific strategies that are useful in teaching a group which includes students with intellectual disability. Provide an outline of what will be taught, highlight key concepts, and provide opportunities to practice new skills and concepts. Provide reading lists well before the start of a course so that reading can begin early. Consider tailoring reading lists and provide guidance to key texts. Allow work to be completed on an in-depth study of a few texts rather than a broad study of many. Whenever you are introducing procedures or processes or giving directions, for example, in a laboratory or computing exercise, ensure that stages or sequences are made clear and are explained in verbal as well as written form. Students may benefit from using assistive technology. Use as many verbal descriptions as possible to supplement material presented on Blackboard or overhead. Reinforce learning by using real-life examples and environment.
Magandang araw po. Kami po yung mga estudyante ng BGS po. Yan po sa interview na po namin. Ikaw na lang po bilang nag-interview namin mga anak. Ano po yung pangalan niya? Gabriel. Ilan taon na po siya? Ano po yung mga pag-uugali niya po? Pag nasa bahay po siya, ganun po. Babait po ba siya?
Masarap daw po ginawa niya sa bigas.
Hindi po matigas yung hindi po siya nagtatantrums. Ano po yung bata pa po siya, ganyan na po siya yung boy po. Nung pinapanganak po siya ng nanay niya, nakitaan na po siya.
Hindi, wala.
Hindi po, bali hindi po siya inborn sa rin. Paano po yun? Nung 3 taon po siya, hindi pa po may nakakalakad. Bali, dapat
Ano lang, nakatingin ka
ganyan po na kami. Pag po inaalagaan, siya kaya naman po niya malising mag-isa mga
Hindi.
Hindi po siya fully developed. May mga kapatid po siya. Tapos ganyan, siya lang po yung ganyan. Nakakaintindi naman po siya. Nakapag-aral, pero nakapag-aral siya. Kasi talaga sa mga spend po, nakasama na po. Sige po, salamat po.